Social media itself is very helpful for medical professionals, whether that's patient outreach, education, marketing. Despite people valuing these platforms, there's very little evidence to guide our social networking practices. And so that's what I kind of wanted to do for plastic surgeons, is to kind of give them an idea of not only the perceptions of plastic surgery using sentiment analysis, but also kind of help guide our practices on the network. The main takeaway was that social messages or tweets with the word plastic surgery in them were more negatively associated than the words reconstruction, aesthetic, and cosmetic. For plastic, the reason why it was more negative when it was compared to cosmetic or aesthetic was the presence of negative words being fails, ugly, fake, never. And then for reconstruction, it was a little bit of a different take. It was the absence of those negative words that made reconstruction so much more positive than plastic. Those words kind of give you an idea of maybe what the public generally associates with the word plastic surgery, being out of proportion, not natural, very easily noticeable, and does not look, something's a little askew. In terms of aesthetic and cosmetic, they didn't have those negative words, so maybe there's actually more balance to those images that they associated. To do this study, we analyzed a large body of social media messages, tweets, using sentiment analysis to find out whether terms related to plastic surgery, that being plastic, cosmetic, reconstruction, were either positive or negative. For us, for plastic surgeons, reconstruction, aesthetic, cosmetic, those all are one thing to us. To the public, this is evidence that it means something different. And perhaps this motivates some plastic surgeons to go onto social media and participate and join the conversation and educate the public.